Everybody, we're live, Facebook Friday. Welcome if you're jumping on. Just checking to make sure everything's working like it should. So if you jump on the stream and you have a question, feel free to throw it in the chat. If you are jumping on, let me know that you can hear me and see me and that everything seems to be working okay, and we will get rolling. Check. Okay, got the video muted or audio muted, so we should be good. Okay, so hey, welcome everybody. Friday afternoon, Facebook Friday, live here. Wes Davis from Circle of Life answering your questions. So if you're jumping on, you can hear me and see me. Let me know in the comments. If you have a question, put them in the comments. So while people are jumping on, I'll let you know there's a new video up on my YouTube channel that talks about the risk of autism associated with tailpipe emissions. That's basically an air quality issue, and probably today is not the best air quality day. So, you know, in the video I talked about the fact that the risk of autism goes up about 7% for every 10 parts per billion of nitric oxide. We don't have nitric oxide levels here in the Utah database, but we do have nitric dioxide. I'm just gonna pull those up right now. Air quality, Utah. Let's see what it is right now. I bet it's at least a cold yellow. Let's try that again, didn't work. Air quality utah.gov and see what it is. Can't figure it out. Let's try it again. Maybe I'm getting the wrong website here. So if you have a question, you can see me on YouTube, you can see me on Facebook. Go ahead and shoot in a question. Oh, hey, Genesis, how's it going? Miscarriage 2 cycles ago, now 10 days late. Before next, maybe, is that what that says? 10 days, BFM, not sure what BFM says. Word last cycle was normal, tubal reversal in April, 2 pregnancies, both ended miscarriage 5 weeks. Miscarriage 2 cycles ago, now 10 days late. Should I be worried? No, I think the only question really, big fat negative, excellent. Thank you. I learned a new abbreviation today, so that's awesome. Don't think you should be worried, but you know the question is always like evaluation of recurrent miscarriage. Sounds like your tubes are working since your tubal reversal, but the question is, you know, what's the deal with recurrent pregnancy loss? There is a video on my YouTube channel that talks about that in some detail. You're on the YouTube channel, so just go to Infertility/trying to conceive. There's a video in there that talks about evaluation of recurrent miscarriage. Okay, getting some, hey folks on Facebook jumping on. Bailey says, having hysterectomy next week, you know, 6 weeks till you can do anything real, but how about feeling normal? So what I tell people is that, you know, it takes about 2 weeks to start to feel like your normal self. Now, you will not be 100% at 2 weeks, and it also, of course, depends on the type of hysterectomy and how involved it was and things like that. But I see most of my laparoscopic robotic hysterectomy patients back at about 2 weeks, and they mostly come in looking normal, normal hair and makeup, and seem normal. They mostly say they're just tired. So fatigue is still a thing and continues to be a thing for a couple more weeks. It's really 4 to 6 weeks to be 100%, but figured about 2 weeks you're pretty good, but kind of tired most likely. All right, hey Bethany, how's it going? Amber, delivering at McKay in March. Do they prevent siblings from existing? Yeah. Okay, so probably in March you'll be okay. Usually, I gotta have something for my hands to do, or I don't know what to do with my hands. Usually, kind of dead of winter, sort of approaching now, January, February, they pretty much go on lockdown, and it just depends on the rate of admission in the NICU for things like RSV and flu and whatnot. And when they see those numbers go up, they lock it down, and then siblings aren't allowed. Until they go on lockdown, which is the situation right now, siblings are allowed as long as they have an adult with them. So for now, you're good. March should probably be good. It just sort of depends on how bad the RSV and flu season is this year. Okay. Can you be pregnant on IUD? Do you get negative home test, positive blood test? Yes, for maybe a day or two. So, you know, urine pregnancy tests are not as sensitive as a blood pregnancy test, although they're pretty good. And, you know, so for example, our office urine tests are sensitive down to a quantitative HCG of about 25. So if you have a really dilute urine, you might miss it on that, or if it was super early, you might miss it. Never wrong to just get a blood pregnancy test in the office if there's a concern. All right, let's see. Although obviously pregnancies pretty rare with an IUD. Let's see. Okay, Fatima says, how many weeks is it safe to fly long journey after normal birth? You know, really, honestly, probably within a week or two, you're fine. I've had patients fly, cross country because they were military and getting changed stations, to some other part of the U.S., flying across country. Even within a couple of days of having a baby, it's more about the baby. And mostly, as far as the baby's concerned, it's about keeping the baby away from everybody else just so they don't get sick. But assuming you feel okay, it's okay to travel. The main risk is just with pregnancy and postpartum is blood clots. So if it's a long journey, of course, you want to be sure to get up and move around every couple of hours, stretch your legs, stay hydrated, just to keep the blood circulating and reduce the risk of blood clots, venous thromboembolism, okay? Cool. All right, let's see what else we got here. Jersey to Disney. Current, 20 weeks pregnant, some anxiety, tried some supplement with some magnesium and some other stuff. Is that safe? The short answer is we don't know. For a couple reasons. One is that, at least in the U.S., supplements are really not regulated, they're not tested, and they're really not guaranteed to even contain what they say they have in them. So it's a little bit of a gamble in terms of what are you actually taking. So it's a little hard to just say yes or no. Probably in general, most supplements are probably of no major risk, but it's just basically impossible to say yes or no on that type question. So let's see, let's keep going. Is starting progesterone right after ovulation good for people with history of low progesterone? The bottom line is that there's no evidence that progesterone supplementation not an IVF story. So if we're talking about IVF, it's a whole different story. But if you're talking about a spontaneous conception, maybe Clomid or Femera, but not IVF, and we could even say not with injectable fertility drugs, then there's really no evidence that progesterone supplementation improves pregnancy rates. So I'm not a huge proponent of that. I don't think it's wrong. I don't think it's harmful, but there's just no good evidence that it really helps. So hope that's helpful. Okay, let's see. Hey, Riley. Next step for checking chromosomes. What is that exactly? How much does it cost? So what we're talking about here is recurrent miscarriage evaluation, and there's a whole video on it on the YouTube channel. You can see all the details. But the specific question here is, what's this chromosome test? So the most common test is called a karyotype. It's a blood test. You can draw it just like any other lab, and you can check mom and then check dad if we're just going to check one at a time. The cost varies totally based on what lab you run it with. It depends on your insurance plan, all those things. But just throwing out round numbers, if you had to pay cash, I bet it's probably $1,000. Maybe a little more, maybe a little less, depending on the lab and all the other variables. But that's what the test is called. It's called a karyotype, and that is kind of one of the final steps we sometimes do if you have like unexplained recurrent miscarriage. Okay, let's see. Katrina, is there an alternative way to find out if you're diabetic without doing the glucose test? Not really. So the short answer to your yes or no question is no. I'm sorry, I hate needles, but it really is the best way. Okay, Kelsey, when can you start running post C-section? Probably 4 to 6 weeks is a good number, and you start out really gently and just kind of ease your way back into it, and if it feels okay, you can increase your activity as tolerated. Jenica, signs and symptoms of cervical cancer. Very often there are none, and that's why pap smear screening is so important. Only in kind of later stages of cervical cancer might you have something like unexplained abnormal bleeding. So bleeding would be the most common symptom, but it's also typically very late in the course. Most likely cancers and precancerous, mostly stuff, is picked up by pap smear. Let's see, Talia. What are the odds of getting pregnant on 100 versus 50 Clomid? Good question. Short answer, I don't think anybody has studies that looked at this dose versus that dose and the percent chance of getting pregnant. It's just all about if you ovulate or not. So if you're not ovulating on 50 milligrams, then the chance of getting pregnant is very low. And if we can get you ovulating on 100, then the chance goes up. So it's not so much that there's any set conception rate based on one dose or another. It's really all about just getting you ovulating. So that's where it really is. That's where it really is all about. If that made sense or not. But so if you have questions about that, there's a new video on my YouTube channel, which I'm just going to go ahead and plug. You people on YouTube know it because you're on it. But if you're watching me on Facebook, if you go to YouTube and just search for this title, Wes D. Ski. That's my channel. And there is a whole section called Infertility, and that is, in there is a video I made called How to Take Clomid or Femara. I literally walk through it day by day. Here's exactly what you do. So maybe go check that out, and if that doesn't answer your questions, let me know. Put a comment in the YouTube video. I can answer it over there if you watch it offline after the fact. Okay, let's see. Catherine, does Ogden Regional do clear drapes for C-sections? They don't have a clear drape at Ogden Regional, but they can try to rig up a mirror. It may take 2 years to bounce around. But yeah, it's all doable. And if you want to see what's going on, if you want to get a preview of what's going on, there's some videos on my YouTube channel of some C-section delivery stories, some of which are more involved than others, varying degrees of what you can see in the video. But there's one on there fairly recently that pretty much shows it start to finish, and it's not gross, but I think it's pretty interesting. But I guess that's what I do, so Okay, let's see if anything's popping up over here on YouTube. I think I'm caught up on YouTube. Hey, over there on YouTube, if you haven't seen me answer your question, retype it, because I think I've answered everything over here on YouTube. We're going to keep answering off of Facebook for now, since nothing's popping up on the YouTube. Okay, Angie. Advice or treatment options for a 13-year-old girl with septate uterus, heavy painful period. So the septate uterus probably doesn't have anything to do with the heavy or painful periods, assuming there's not a imperforate hymen, that would be obstructing the vaginal flow of menstrual blood. It's probably just she has horrible periods, and really, so a bigger question is, what can you do for horrible periods? Birth control pills, honestly, are really one of the best things you can do to help reduce the pain, reduce the flow. The septate uterus is a separate question. It doesn't have anything to do with the symptoms she's having, I don't think, but does have implications for fertility down the road. Some of those are resectable. We can put a little hysteroscope up inside the uterus, and if it's a thin septum, you can kind of shave it out and make one normal cavity, assuming that's what it is. But don't think it has anything to do with the pain per se, assuming there's normal ability for the blood to flow out. Kelsey, let's see, how long postpartum do you continue to massage the abdomen uterus? You don't have to worry about that at all, Kelsey. When you're in the hospital and you just had a baby and they're doing this little fundal checks and uterine massage, that's mostly just to ensure you're not getting into any concerns about heavy bleeding immediately postpartum, but it doesn't make the uterus get smaller any faster or anything. So, and we check it just on rounds to be sure that, yep, it's shrinking down while you're in the hospital, again, for the same reasons, to make sure there's not any sort of occult bleeding building up inside the uterus. But once you're home, you don't need to worry about that at all. Okay, let's see. What is recommended BMI before starting fertility treatments? Well, of course, it's as healthy, as close to ideal as it can be. And if you look at just Google BMI, and you'll see see what the numbers are. You can even find BMI calculators that calculate what your weight should be for your height and things like that. But I would just as close to the normal BMI as possible. That's not always possible, but that's where you want to shoot for. Okay, I saw something else pop up over here. When planning to have VBAC in 37 weeks, start feeling pains, lower abdomen, waking up from sleep, is it bad sign of uterine rupture? No, I agree with Dee Dee. Everything hurts in the third trimester. The most common sign of uterine scar complications in pregnancy is not pain. And to back up a little bit, the most common time that you might have a uterine scar complication like a rupture is actually in labor. And the most common sign of that is an abnormal fetal heart rate tracing, which is why we always want to have continuous fetal heart rate monitoring for someone who's trying for a VBAC. Lower abdominal pain, sharp, shooty stuff is almost always just normal pregnancy. So if the baby's moving good, you're not bleeding, you're not having regular contractions, it's almost never going to be a uterine scar thing. It's much more likely just to be pregnancy related. So Didi, as always, is right. Okay, everything hurts. Let's see, Sydney, tips to help prevent tearing during birth. It's a good question. It's been looked at from a lot of different studies and different ways of trying to minimize perineal damage at vaginal delivery. Excuse me. And the number one thing you do is you don't do episiotomies unless they're absolutely necessary. Our goal at McKay, and I see all the numbers, our goal is, that sounded really weird, but anyway, we're looking at episiotomy rates as something you can track. and the hospital-wide goal is to be less than 5%. We actually had a doctor last year, and I can name him because it's nothing to be proud of, had a 0% episiotomy rate. That was Dr. Beers, one of my partners. And he also had the most deliveries in the hospital at McKay last year, so he gets the gold star public praise for doing the right thing. And I think I was right behind him because I did like one. So the big thing is just don't do episiotomies if you can help it, because that increases the risk of damage when you do deliver. Beyond that, just kind of perineal support, warm compresses sometimes have been shown to help. Trying to have as controlled of a delivery as possible maybe helps. But more than anything, it's just don't do an episiotomy. Okay, Jordan, do we do, we don't do IVF. We do intrauterine inseminations, which maybe I think that's what you meant when you typed IVI. So we do IUI, intrauterine inseminations. But IVF is done with the specialty centers, so either the university or reproductive care center or Utah fertility, places like that are the places that do in vitro. It's a very high-tech, very specialized treatment that requires subspecialty level expertise, training, and a very high-tech lab. So those are the folks that do that, but we do intrauterine inseminations, but it's a good question. Let's see. I think I'm kind of caught up. Yeah, I think I am. Okay. Well, if you guys are jumping on, put a question in the chat. If I haven't answered your question, let me know. I don't see any that I've missed, but sometimes they just don't pop up in my feed for whatever reason. And so far, the dog's not snoring. He was snoring really loud when I started this thing, woke him up. Okay, let's see. How often do we do IUIs at your office? Very frequently. You know, there's at least one a day every day. We're open, sometimes 2 or 3. Just depends on, you know, the number of patients that are coming through the office that day. Very common, all the time. Let's see. Brittany, can you leave a fairly big Bartholin cyst alone if it doesn't cause you pain? Generally speaking, in a young person, like not postmenopausal, who has a small asymptomatic Bartholin's gland cyst, they're perfectly fine to leave alone. They often do become painful. They can either become infected or just sort of acutely inflamed, and then drainage is necessary just to relieve symptoms. And if they are recurrent and painful, sometimes we either remove the gland or drain it in a way called marsupialization, where you try to make kind of a permanent draining path of that cyst so it quits building up. So basically your answer to your question is yes, it's okay. All right, Jordan, so 1 tube, OB says no other options, looking IUIs, do you have any advice? Always went to house until you moved. Do I have any advice? Well, if your 1 tube is open, then you're still okay for IUIs. So you can do inseminations as long as you have at least 1 tube and an ovary, hopefully on the same side as that tube. Then in theory, it should work fine. I don't know if they said, you know, beyond that, you only had 1 tube, was it open or not? That'd be the question. But in general, it should be fine. IVF, of course, if you have no tubes or no functional tubes, or if there's concerns with, say, severe sperm issues, you know, where poor motility or poor numbers, then in those situations, IVF is a good choice. Let's see. Okay. Dee Dee's answering my questions for me over here. Thanks, Dee Dee. Kimberly, how do you feel about chiropractic care during pregnancy? It's fine, particularly like, you know, back pain and just like manipulation of the lower back. Sacroiliac joint area is a fairly common place to hurt in pregnancy. And that's fine. They can do adjustments. They're not going to cause any harm. There's really some decent evidence that chiropractic adjustments for low back pain is somewhat helpful for reducing pain. So I think it's fine. Let's see, Amber. For planned sections, McKay offers for gentle C-section, clear drapes. They do have clear drapes. They do allow you to do skin to skin. So pretty much the answer to your question is yes. And it's kind of like, you know, assuming. So assuming that everything's going okay, assuming that it's a chill and repeat C-section or planned primary C-section, and that everything is no problem, then yep, they can do all these things. Saw something pop up over here. Do I believe acupuncture to help PCOS? Well, you know, I don't know of any data specifically for PCOS, but I will tell you that there's a video I haven't made, but I've got it ready to make, and I need to make it, and I keep saying I'm going to make it, and I keep forgetting to make it, and it's about acupuncture. So acupuncture has been studied in vitro, which is not the same as, you know, other types of fertility treatments, but, you know, the most high-tech option, IVF, and it made no difference. And it was a really well-designed study. It was done in Australia. They had certified acupuncturists. They had a very standardized technique that followed the traditional Chinese medicine acupuncture techniques, and they compared them to a sham procedure which looked just like the regular thing, but they poked the needle in the wrong spot on purpose, and there was no difference in pregnancy rates. So if you translate that to a PCOS type setting, which again, just under fertility setting, then I think my answer is it probably doesn't help. It's not going to hurt anything. There was definitely no proof in the studies that I'm telling you about that there was any harm, but it does cost money and it does take time. And so if you look at those kind of things as potential harm, spending money didn't need to spend, doing things that didn't work, then yeah. So I don't personally recommend it. Okay, let's see. I'm getting behind here on Facebook. Let me get back on it here. Okay. Amber, I got that one. For the glucose test, are there other options besides the sugary drink? No. No options that are the correct thing to do. Now, historically, some people, not naming any names, have done like a can of Coke and a candy bar, which is completely not right. It's not pure glucose. There's caffeine, there's carbonation, there's all kinds of other crap in a can of soda and in a candy bar that have nothing to do with glucose metabolism. They do not give accurate results. We just don't do it. When I came to town, sorry anybody who did it the old way, it stopped because I was like, come on people, this is not evidence-based medicine. Okay, let's see. Okay, cool. Yeah, and like Dee Dee said, the glucose isn't that bad anyway. I have had one. People say, well, have you had it? Yes, I have. We have lemon lime, which is kind of like a flat Sprite. We have an orange. We have fruit punch. None of them are terrible. They're just really sugary. Yeah, Kim says fruit punch was okay. Let's see. Jess Burnham, can you have postpartum depression after miscarriage? Well, it wouldn't technically be postpartum depression, but certainly you could have, worsening of a depression symptoms after any type of trauma, whether it's a miscarriage or anything else in life, and perhaps the hormonal fluctuations that occur after a miscarriage are enough for some person to trigger depression. Absolutely, it just technically wouldn't be postpartum depression; it would be depression. And so I would look at just symptoms, duration of symptoms. If it's at least 2 weeks, are the symptoms causing impact in quality of life, function in life, things like that. And if you're starting to tick off some of those boxes, then it starts to sound like depression. And certainly, once it gets bad enough and long enough, it's very reasonable to treat it. Okay, let's see. Let's go back here through Justice. Did I say that? Justice P. My doctor put me on metformin for PCOS and hypothyroidism. Been trying for 3 years. Clomid, no positive. We try letrozole. Yes. There's a sub question in there. You didn't say, but if you've done Clomid by itself and getting pregnant, then there is evidence that metformin with Clomid could help in that specific subclass of people. So subclass of patients who are not responding to Clomid. So you did metformin plus Clomid, that might help. But there are certain subsets of PCOS patients that don't respond to metformin or to Clomid and do respond to letrozole, which is Femara. So yes, good question. And that is what I would recommend next. And if that didn't get you going, then I would do Femara plus injectable follicle stimulating hormone, FSH, as the next step. And it's usually pretty low dose and it's usually fairly inexpensive. Okay. Can a Bartholin cyst cause a hernia? No. So the space where the Bartholin cyst exists is not connected to your inguinal canal. Inguinal hernia, completely different and separate, and a femoral hernia is completely separate space as well from the Bartholin's gland. So they're unrelated. Now someone could potentially misdiagnose one as the other, and that would be unfortunate. If you opened up what you thought was a Bartholin cyst and found it was a hernia, that would be bad luck. But in the normal situation, that would be very rare. Okay, let's see. Catherine, this might be interesting. I don't know what, this could be good, you guys. Okay, let's see. Any take on baby mapping? I don't know what that is. I know little one is breached, but kicks movements changing all the time, plus I think she's stepping on your pelvis. So I'm not sure what baby mapping is. Can someone tell me? Because maybe I don't really know. I want to learn something new today, so tell me what baby mapping is, and then I'll try to answer your question. And Jordan, you're welcome. I love doing these. This is like my favorite thing to do on a Friday afternoon. So yeah, Facebook Friday. That's what it's all about. And let's see if we're caught up. I think we're caught up. Nope, here we go. Is it safe to do microblading during pregnancy? Yeah, I think that's fine. I don't think there's any concern with that. Yeah, so I think I'm all caught up. Still no snoring dog, but boy, he's out cold. Okay. Taylor, just told again not to try again for 2 months after third miscarriage, said Lana. So, no. So question is like, how long do you need to wait after having a miscarriage to try again? And the traditional kind of tried and true answer was to wait some period of time. Is it 3 months? Is it 2 months? Is it 6 months? Whatever. And that's actually been studied. I'll have to go back and find the actual study so I can quote the numbers. I need a piece of paper. Hang on. I need to write these down. Acupuncture and timing to try to conceive after miscarriage. Okay, so it's been studied, and I forget the numbers, but just telling you off the top of my head that I remember reading the study about this question. And the answer was that the sooner you started trying to conceive, the better. So your chances of getting, wow, that camera's really wobbly, sorry. There we go. The chances of trying to get pregnant, the chance of getting pregnant after a miscarriage are higher the sooner you start trying. So this idea of like your lining is too weak or whatever, it's just not scientifically sound. Sorry, I'm trying to adjust this camera still a little bit. It's just not scientifically sound. And there's a study that completely contradicts that statement. So it's fine to start trying again. Chances of actually getting pregnant and staying pregnant and taking home a baby were higher the sooner you started trying. So let's see. Why is that? I don't know. Maybe they haven't read the study. I'll have to go track it down, but I don't have time to track it down right now. But it is, but it's a thing. Okay. Let's see. So, Catherine, this is about the baby mapping. Basically, finding out how the baby's situated without an ultrasound be done at home seems like fun. Yeah, if you can really feel what's up, then sure, go for it. We used to do that in the old days too. It's called Leopold's maneuvers, and basically, you kind of use your hands. It's like, okay, this feels like a head. This feels like a butt. This is the feet or whatever. And I'd say I was right about half the time. And doing ultrasound every day now, like I have for the last 10 years, I can tell you that it's easy to get fooled. It is easy to think you're feeling a head, and it's actually the butt, or vice versa. So, but it's fun to try, so no harm. Let's see, Allie, let's see. Since having third baby, very emotional, and seems to have gotten worse. Nursing, stopped nursing a month ago, like 13 months postpartum. Could be hormone driven. Best options. Would like to avoid birth control. Yada yada. Okay. Well, you didn't say you wanted to avoid. You didn't say you wanted to avoid medications for depression, and so if you and I've talked about that just a second ago. Like if it's of a long enough duration, symptoms have been over 2 weeks. If the symptoms are severe to the extent that they're affecting your ability to get through the day, to function, to enjoy life. Then, and especially for other symptoms like depressed mood, decreased appetite, problem sleeping, anxiety, things like that, it's not wrong to consider an antidepressant. So although it is postpartum, and although that probably does have a hormonal component, doesn't mean you have to treat it with hormones. So if you're trying to avoid hormones, then maybe you consider something like, Paxil, Prozac, Zoloft, one of these SSRIs. So that's maybe something to consider. Okay, let's see, here we go. Kimberly, is it true you can't use a copper IUD if you have a bigger uterus? No. They're probably, and Wellbutrin mentioned, Dee mentioned Wellbutrin, also good too. So there's no, if you read the sort of package insert for IUDs, I don't think there's anything in there about if your uterus is bigger than X, you can't use an IUD. I don't think that's a thing. Now, it is true that if your uterus isn't big enough to put one in, then you can't use it. And so generally speaking, the IUD frame is about 3 centimeters, 4 centimeters. So if you don't have at least that much of a uterine cavity, which would be really weird, then you probably should IUD because it wouldn't accommodate the IUD. But I've never seen anything about like if your uterus is X centimeters bigger than whatever, then you can't do it. I don't think that's a thing. Good question though. Let's see, hypothyroid contributing to fertility? Maybe. So ovulatory dysfunction. So the question is, sorry, I forget that people who are watching on Facebook don't see the YouTube comments and vice versa. So the question is, does thyroid disease affect fertility? The answer is yes. Does one affect it more than the other? Probably also yes. Hypothyroidism is probably more likely to impede ovulation. So if you're badly hypothyroid, your periods will go out of whack. So you may not ovulate at all. You may ovulate infrequently. Your periods may become very irregular, and that could make it difficult to get pregnant. The real question is like, what about subclinical hypothyroidism? And the data is really limited and kind of mixed. I never think it's wrong to treat someone's mild subclinical hypothyroidism if they're having fertility problems. It's not gonna hurt anything, and it might help, but I think you have to be pretty far off from normal to say it definitely would affect fertility, and I think that it might in the more subtle cases. Okay, Ricardo, I have a ghost living in your dresser that hates fish. A ghost. If I take the fish, this is great. This is going. This sounds like Schrodinger's cat. So that's pretty good. Thanks there, Ricardo. Keeps going. Okay, so I think I'm all caught up. If you're bored, you can read Ricardo's post. It's pretty crazy. All right. Before I was coming on live, or as I was coming on live and you guys were jumping on or maybe weren't even on yet, I was talking about one other thing. There's a new video on my channel that talks about the risk of autism associated with auto emissions, and it's pretty impressive. So if you haven't watched it, go check it out. I don't mean that the video is impressive. I mean the findings from the study were impressive. There is something on the neighborhood of a 7% increased risk of autism in moms who were exposed when they were pregnant per every 10 parts per billion exposure to nitric oxide, nitric dioxide, which are what are basically what comes out of your tailpipe. And that's what basically we're breathing outside right now in Utah, because we've got an inversion. I'm looking out the window and it looks just awful. And I was actually trying to figure out what the air quality was in Utah right now. And I kept getting directed to a bad website, but here it is. PM 2.5 right now, 41.7, which is orange. That's bad. They have a burn ban on right now. So they don't list the nitric oxide, nitric dioxide, but they all tend to kind of follow the same trends when you're talking about an inversion. So we're typically in the 50 to 80 parts per billion of nitric dioxide here in Utah during an inversion, and it can go as high as 80. So we're in pretty bad air quality situation right now. So, if you are pregnant, there is at least one big study out of Canada that looked at 130-some thousand pregnant women over something like 10 years and showed that like I said, every 10 parts per billion exposure per trimester on average, you got about a 7% risk increase for autism spectrum disorder in your offspring. So today's a good day to not be outside a lot. Today's a good day to carpool if you got to go somewhere, or use public transit, or drive an electric car. And don't burn things outside today, because that's going to make the air worse. Let's see, and it's all about it in the video. Check it out. Megan, what are the symptoms and treatments for PCOS? Wow, that's a biggie. And there's actually a whole video on it on my YouTube channel. So I would tell you that if you want the whole shebang, go watch the video. Symptoms real quick, infrequent periods, maybe going 40, 50, 60 days between periods. Signs of androgen excess, so increased facial hair, increased acne, associated with being overweight, often associated with varying degrees of glucose intolerance, often associated with infertility. So that's kind of the quick version of the symptoms. Treatments mostly revolve around diet and exercise for weight loss. And then if you're trying to get pregnant, it evolves around ovulation induction. See you, Didi. Take care. And then as far as treatment of the other symptoms, sometimes metformin is useful to reduce some of the signs of acne excess, or you could use like spironolactone to reduce your acne and facial hair and stuff like that. So that's kind of the quickie version. If you want to learn more about that, go to my YouTube channel. I posted the name of it, but if you just go put in Wesley Davis MD, you'll find it, or Wes D Ski, and there's a whole big video on PCOS. Sam asks, what's your view of ADI? Are you allowed to prescribe it? Yeah, it's a very infrequently discussed medication, and it's interesting. And, the short answer, yes, it's fine. It doesn't work very well and has a lot of side effects, including like passing out. And you can't take it with alcohol or you can really pass out. It's for treatment of decreased libido, specifically FDA approved for postmenopausal women with low libido. Doesn't mean you couldn't use it as a non-postmenopausal person or as a premenopausal person. But the studies were done in postmenopause. It's expensive. It may or may not be covered by insurance. But what I was going to say is, just right now, if you're watching this, Sam, instead of watching me, or do it right after you're done, Google Stephen Colbert ADI. He had the funniest clip explaining the side effects of that drug, and I would encourage everybody at some point, go watch. It is hilarious. I cannot even begin to do justice to the comedic genius of that man. And that segment was the funniest thing I've ever seen on Stephen. He's actually Colbert, but everybody says Colbert. So check it out. All right, I think I'm caught up. We should all just go watch Stephen Colbert. It's pretty funny. But do it after this. Okay, let's see. Kimberly, how early in a pregnancy can you tell if your baby has Down syndrome? Well, so there's new testing now at about 10 weeks. That's the cell-free DNA test. It goes by many different names. Progenity's one lab. There's Maternity 21. There's 2 or 3 others. They're all the same. And so what they're doing in that particular test is isolating fetal DNA from the maternal circulation. And they can sequence that DNA with little DNA probes. They call them SNPs. And I'm not a DNA specialist, but this is the big picture how it works. And they can probe the blood and figure out how many copies of this chromosome 21 are in the circulation. They can tell the difference between maternal and fetal. And so if they pick up 3, then that's Down syndrome. And if they pick up 2, then it's normal. And they can do that for other trisomies as well. So trisomy 18 and trisomy 13, less well-known trisomies, but also fairly frequent. And they also test the sex chromosomes because there is a little bit of a higher risk of sex chromosome abnormalities if you're over 35. It also, of course, means you get to find out the gender, which is cool. But I mean, honestly, you find out the gender eventually anyway. But if you want to know super early, that's maybe one reason to consider that test over any other. There's also what's called the first trimester screen, which you can do at around 12 weeks. And that involves ultrasound measurement of the nuchal translucency, which is this little fluid behind the back of the neck here, between the back of the skin and the back of the neck, basically. Is normally a very thin space, but if it is thickened, that's a sign that it's potentially associated with a higher risk of Down syndrome. It also involves drawing some maternal blood and looking at a couple different things called pregnancy-associated protein A, and that one also has inhibin, and those are all kind of plugged into a model, and that gives you the assessment of risk for Downs. So that one's at about 12 weeks. Then you can do, if you didn't like to do that one, you do quad screen at 15 weeks, which is looking at some old standard hormones and proteins that have been around forever to assess your risk. And then also ultimately ultrasound is a reasonable screening tool. Typically more of a complete ultrasound scan around 18 to 20 weeks, where there's all kinds of different things you can look for that are associated with chromosomal abnormalities. So any and or all of these are reasonable potential options for someone who's interested in screening for Down syndrome or other chromosomal abnormalities. And there's a video on my YouTube channel that talks about that in a little more detail. It was mostly geared at the over 35 crowd, but really the discussion is appropriate for anybody. But the title of that video is something like, is 35 too old to get pregnant? Which the answer is no, it's not, but that was just a catchy title. So check it out if you're curious. Let's see. How long would you try Clomid before switching to Femera? You're on Clomid and metformin. Certainly reasonable, 2 or 3 cycles at each dose, so 50 milligrams, 100 milligrams, 150 milligrams. If you're not ovulating, to bump up the dose until you find the dose that helps you ovulate. And then I certainly wouldn't go more than 6 cycles on Clomid. And I generally don't go more than 3 or 4 just because most of the evidence would suggest that most pregnancies occur in the first few ovulatory cycles of Clomid, and after that it actually becomes a little bit common to get pregnant. And so if you haven't by then, I move on to letrozole or Femara. So that's kind of my usual approach to that. And there is a video on the channel about how to take it. So I do it like day by day, step by step. Here's what I do. I write it out on the calendar and I show you how it goes. So if you're curious, you can watch that video on the YouTube channel. All right. So, hey everybody on Facebook, nobody's putting any questions up. I don't see any questions popping up. So if you guys have a question, hit me up. And hey, just curious, I always like to do this. Where's everybody watching for? I know Dee Dee was watching from Texas, and she's probably already gone. But for the rest of you that are watching, where are you watching from today? Let me know. And then there's this long pause, because whatever I say on here takes like a minute or 30 seconds or something to go to the internet and to your screen so you can see it, and then a few seconds for you to type a response. And so in the meantime, I kind of sit here and wait and see if anybody says anything, and so far nobody's saying anything. Oh, Sam said, thanks, you're welcome. So we're waiting for a question or for someone to tell me where you're watching from, because I'm just curious. I have someone that pops on from Italy every now and then. I haven't seen her pop on today. Syracuse, always get representing Syracuse. Good job, Megan. Get a lot of the 844 area codes. Leighton, there you go. Hillary, how's it going? Anybody else? Anybody on YouTube over there? Where are you guys watching from? Sometimes YouTube is more of an international crowd. I've had somebody from Italy the last couple times. I had somebody from Guam. Riverdale Road. Love it. All right. Let's see if anybody else says where they're watching from. Huntington. Huntington, is that like, where's Huntington? That's bad. Is that around here somewhere? My car. Don't drive and YouTube at the same time. But that's awesome. But I'm glad you're riding, not driving, Penny. That's good. Stay safe. All right. IKEA. Good luck at IKEA. I get so lost and overwhelmed at IKEA. I always feel like I've been in there for 3 days. And then you got to put the thing together, which to me for IKEA is the hardest part. Let's see where else we got it from. I got some heart signs going up. That's cool. Who else is chiming in yet as to where they're watching from? YouTube is kind of dying off, but we'll keep YouTube going for a minute. If it dies off completely, I might switch over to Instagram to see if anybody picks up on Instagram. South of Price, there you go. Yeah, Jamie, how's it going? That's awesome. Thanks it's good to hear from you. Price is on the way to Moab, right? I think that's right. Or is that on the way to Zion? I only know like the towns on the way to those places for like where you stop to get gas. And so I know I've stopped in Price, but I can't remember where that is. Oh, you're saying Huntington is south of Price. I got you. You know what? I got this great thing here called Google Maps. Huntington, Utah. 84528. That's all down there. Let's see. Huntington, Emory County. That may, well, so far you're winning because that's down there a ways. Nobody out of state yet so far is chiming in. Yeah. Well, actually, you could go to, whoa, you could go to Zion or Moab and kind of go through that area depending on which way you want to go. All right, cool. Let's see. Husband and I are considering in vitro, but you're told the injections can trigger certain kinds of cancer. Is that true? Short answer, probably not. There are some concerns about potential risk of ovarian cancer from ovarian stimulation. Did I say that right? Stimulation. But it appears that if there is a risk, it's probably very, very small. And that makes sense because when you think about the amount of time you're exposed to those like follicle stimulating hormone and stuff like that, it's very minimal in the grand scheme of your life. So I'm not saying whatever that says. Can you say whatever that is? I never say anything that people say, can you say? Because you never know what they're trying to get you to say. Let's see. But anyway, so the bottom line question is, is there a significant risk? And I think the short answer is no, I don't think there is. Let's see, Sydney, what are your thoughts on choosing to be induced for baby number 2? I think it's fine. And really, you know, baby number 1, now this is based on a very well-designed study called the ARRIVE trial. We participated through McCady Hospital. That was part of the Maternal Fetal Medicine Unit's network study called the ARRIVE trial. And they were looking at first-time moms, which you would think if you're going to induce somebody, the biggest time you're going to risk having bad things happen is on a first-time mom, not a second-time mom. And the interesting findings were lower risk of C-section, lower risk of hypertensive complications in the induction group. So the moms who got induced had a lower risk of C-section than the moms who waited for spontaneous labor beyond 40 weeks, let's say, because that's kind of where the breakdown was, because it was 30 to 40 or 41. So if you translate that data to baby number 2, where you figure it's only going to be better, not worse, then the evidence would suggest that there's really no downside from a C-section standpoint. There was no evidence of any adverse outcomes for the baby either way. So whether you waited or got induced didn't seem to matter to the baby, but it did matter to moms from a C-section standpoint, and it did matter from a blood pressure standpoint. So, you know, I think for baby number 2, it would only be as good or if not better. So I don't see any downside as long as you're at least 39 weeks, because that's where we know the baby's going to be good from a lung maturity standpoint. So we need to have good dates. We need to be at least 39 weeks. And it's never a bad idea to have a favorable cervix, but really the ARRIVE trial was studied regardless of cervical Bishop score. So it didn't matter if your cervix was closed and thick or if you were 3 centimeters. That was part of the study as well. So it didn't seem to matter ultimately to the outcomes that I mentioned. So there you go. Let's see if anything else is popping up on YouTube. Doesn't look like it. All right, cool. So good grief, we've already been going for like almost an hour here on this live stream. So if you have any questions, fire away. We'll wrap it up here shortly. So if you have other questions, put them in the chat right quick, because probably going to shut this down here in a couple minutes. And then I'm packing up and we're heading off to Indian Wells. It's like Palm Springs for a half Ironman. So maybe I'll make a little video about that if it's not too crazy. It's half Ironman number 6 for me, I think. My wife's doing it as well. She's doing number 2. She did her first one in Vichy, France this summer. So now we're doing one here just down the ways in California. And the race is on Sunday. So that's my life. Waiting for it to snow more. Here we go. Riley, here's a question. 3 cycles of Clomid down. 2 cycles were successful, but didn't work out. 3rd cycle ovulated, weren't successful. Is it worth trying for a 4th? Yeah, well, again, it's all about if you ovulate or not when it comes to Clomid. There's really no evidence that if you're ovulatory, that increasing the dose is going to increase your pregnancy chances. So I think if you're ovulating on your current dose, then 50 milligrams is fine. And it's, you know, it's not wrong to switch to Femara sometime in the next couple cycles. But I think at your current dose, if you're ovulating, then that's totally fine. And there's really no upside to increasing the dose because all you potentially get is you get a higher rate of twins maybe. Switch to different med. Yeah, so Femara is the other option. And either one's fine. And you can, if you want to call in the office and get them to put a phone note in your chart, I can answer it kind of offline. So I have an opportunity to look at your chart and kind of get you a better answer. Okay, let's see, thoughts on being induced, we did that already. Okay, so we're caught up. I'll give you guys another second or two. If you have other questions, feel free to pop them in. The big winner so far is Jamie from Huntington, Utah, which is on down the road a ways, but is still within the state of Utah. Dee Dee was on here from Texas, so I think she's the winner on YouTube. You're welcome, Riley. So it looks like Texas reigned supreme today for furthest distance traveled for a YouTube video. Last time it was from Italy, which is pretty cool. All right, well, thanks to everybody. I think we'll close it down because I'm not seeing any more questions. Arkansas, oh, there it is, Arkansas. We got a winner. Arkansas is the other side of Texas, right? So I think you're further away. You win. So yeah, I'm not seeing any other questions popping up. Thanks to everybody. Thanks everybody watching. Thank you. Really appreciate your questions. Otherwise, I'm just sitting here babbling with nothing better to say. So once again, another fun Facebook Friday and YouTube Live Friday, 2-for-1 stream today. Thanks everybody for watching. Hope you have a great weekend. Catch you again maybe in a Friday or two. All right. See you later. Bye.